On behalf of my co-authors at the Missouri Orthopedic Institute, I present Arthroscopic Pectoralis Minor Release. After diagnostic arthroscopy of the shoulder in the beach chair position, an anterior portal is established at the lateral margin of the rotator interval. Rotator interval debridement is performed using a shaver and radiofrequency device to expose the posterior aspect of the coracoid. The conjoint tendon is identified and its margins are clearly delineated. A few millimeters of the posterior-inferior coracoid can be resected if subcoracoid impingement is suspected. Care is taken to avoid injury to the conjoint tendon. The space anterior to the coracoid is preliminarily debrided and the camera is switched to the anterior portal. A mid-coracoid portal is established at the medial aspect of the coracoid under direct arthroscopic visualization. Fascia overlying the pectoralis minor muscle belly and tendon is carefully debrided using blunt dissection, a shaver, and a radiofrequency device. The tubular structure of the musculocutaneous nerve can be identified at the inferior border of the pectoralis minor musculotendinous junction. The pectoralis minor tendon is released from the medial border of the coracoid using a radiofrequency device and arthroscopic basket. Further blunt dissection is used to ensure the tendon and muscle belly are fully freed from surrounding fascia. The musculocutaneous nerve and its surrounding paraneural fat are now clearly visualized. The pectoralis major muscle belly can be seen retracting medially. A soft sling is worn only for comfort in the initial postoperative period. No formal range of motion restrictions are put into place. Scapular stabilization and range of motion modalities are performed in therapy from weeks 0 to 4. An interval return to sport throwing program is subsequently performed. Pearls of this technique include the establishment of an anterior portal laterally within the rotator interval to improve later visualization anterior to the coracoid. Pectoralis minor release is performed via instrumentation through the mid-coracoid portal via a combination of blunt dissection, shaver, and electrocautery. Pitfalls of this technique include a risk to surrounding neurovascular structures, specifically the musculocutaneous nerve and axillary artery. Incomplete release and fascial debridement of the pectoralis minor tendon may lead to persistence of pain. And lastly, a complete arthroscopic analysis of the joint is necessary to rule out concomitant pathology. Thank you for your interest in this technique.